Greetings, New Zealand naturopath Eric Backer, author of Candida Crusher. Thanks for checking out my video. I've got a question here from a lady in France who's asking me, that's wrong sheet, can Candida cause gastroparesis? Right, that's an interesting question. Who knows what gastroparesis is? It's a condition that's not that uncommon, and I believe around 3 or 4% of people in the US have it. You will often find it in particular with people that tend to be on the large side or obese. It can occur in people that aren't large, but a large population of people with gastroparesis are quite big people. It basically means an inability of the stomach contents to really empty properly, or a delayed emptying of the gastric contents. So motility issue. There are different etiologies or causations of gastroparesis. A common thing that occurs is a problem with the vagus nerve, one of the biggest parasympathetic nerve we have in the body, that can cause a problem with the stomach to really function properly. But obesity in general has many complications that can cause it. Some of the causes of it excuse me, are diabetes, especially if it's not controlled properly. Gastric surgery with injury to the vagus nerve. There are various kind of medications that can slow motility right down. So if you're taking some kind of drug and you're finding that you're getting a lot of upper tummy pain, or you're burping, bloating, bowels aren't working properly, there could be a motility issue there. So you need to get checked out by the doctor, especially if you're taking medication. Of course, diseases like Parkinson's disease or multiple sclerosis, which will affect the nerves in general of the digestive system and other parts of the body. And there's some other rare conditions. There's one called amyloidosis, which is sort of development of the deposition of protein in different parts of the body. These are all rare, but generally a large percentage, as I mentioned, are bigger people. So obviously one of the big things to do is to lose weight if you've got a problem, with the gastroparesis. Medications are commonly used. You've got mild gastroparesis cases, you've got the intermediate phase, and then you've got the failure for the contents to empty. And the mild cases, the doctor will often recommend just generally weight loss, and a diet change. And sometimes they might recommend some enzymes. In the moderate cases, they're going to look at a prokinetic medication often. So a drug, there are different kinds of drugs they use to help speed, the movement through the digestive system of foods. And then in the severe cases, you could look at endoscopy or IV treatments or surgical interventions or things like that. So what are some of the symptoms of gastroparesis? Well, one of the key ones is heartburn, bad heartburn. Nausea. 90% of people with gastroparesis suffer from nausea, and also a large percentage have vomiting of food contents. Feeling full quickly after eating, and everything's sort of building up in here. It's 92% get abdominal bloating, and 40 to 80% get abdominal pain, so pains in the gut. Now, a big thing that occurs, of course, if the stomach is not really is delaying in its ability to release the contents, you can get a problem with food building up. And that can cause all sorts of problems. Candida can often come along for the ride. In fact, one study in 1987 found Candida esophagitis. When they did endoscopes on a group of people, they found a large percentage, in fact, had Candida in their throat, deep down with endoscopy. So did the Candida cause the gastroparesis, or did the paresis cause the Candida? I would say that gastroparesis caused the Candida, because it's commonly found, remember, in diabetics. And it commonly is also associated with blood sugar issues. So, of course, that can really allow Candida to thrive. So I would certainly see a relationship here with gastroparesis and yeast infection. So if you've got a gastroparesis condition, be sure to lose weight. That's the number one thing. Second thing is make sure you take some enzymes. Enzymes are going to work really well. Probiotics and enzyme combination works fantastic with gastroparesis in the mild to moderate cases. The more a problem you've got, the more likelihood you're going to need a more serious intervention. But the big thing is lose weight. If you've got all that weight you're carrying, just try and get rid of it. There are different ways to lose weight. So see your healthcare provider about that. So to answer that question succinctly, yes, there is a relationship between Candida and gastroparesis, but I would not, in my opinion, believe that Candida causes gastroparesis. I would believe there's a relationship between them both. Thanks for tuning in.